Seeking medical attention. When to go to the doctor and why it matters. Seeking medical attention is an important part of maintaining good health and preventing illnesses from becoming more serious. However, many people are unsure about when to seek medical attention and may put off visiting the doctor until their symptoms become severe. In this article, we'll explore the importance of seeking medical attention, when to go to the doctor, and what to expect during a medical visit. Why seeking medical attention is important. Seeking medical attention is important for several reasons. 1. Prevention. Regular medical checkups can help prevent illnesses and detect health problems early, when they are easier to treat. 2. Early detection. Seeking medical attention early can help detect health problems before they become more serious. 3. Effective treatment. Medical attention can provide effective treatment for many health problems, reducing symptoms and improving quality of life. 4. Reducing complications. Seeking medical attention can help reduce the risk of complications from illnesses and injuries. When to seek medical attention. There are many situations in which seeking medical attention is necessary. Some common reasons to seek medical attention include: 1. Severe symptoms. If you are experiencing severe symptoms, such as difficulty breathing, chest pain, or severe headaches, seek medical attention immediately. 2. Injuries. If you have been injured, seek medical attention to ensure that the injury is properly treated and to reduce the risk of complications. 3. Illnesses. If you are experiencing symptoms of an illness, such as fever, vomiting, or diarrhea, seek medical attention to determine the cause and receive treatment. 4. Chronic conditions. If you have a chronic condition, such as diabetes or high blood pressure, seek medical attention regularly to monitor your condition and adjust your treatment plan as needed. What to expect during a medical visit. During a medical visit, you can expect the following. 1. Medical history. Your doctor will ask about your medical history, including your symptoms, medical conditions, and medications. 2. Physical examination. Your doctor will perform a physical examination to assess your overall health and identify any potential health problems. 3. Diagnostic tests. Your doctor may order diagnostic tests, such as blood tests or imaging tests, to help diagnose your condition. 4. Treatment plan. Your doctor will develop a treatment plan to address your health problems and improve your overall health. Types of medical visits. There are several types of medical visits, including: 1. Primary care visits. Primary care visits are routine visits to your primary care physician for general health care and prevention. 2. Specialty care visits. Specialty care visits are visits to a specialist, such as a cardiologist or dermatologist, for specific health problems. 3. Urgent care visits. Urgent care visits are visits to an urgent care center for immediate medical attention for non-life-threatening conditions. 4. Emergency room visits. Emergency room visits are visits to the emergency room for life-threatening conditions, such as severe injuries or illnesses. Preparing for a medical visit. To prepare for a medical visit, follow these tips. 1. Make a list of symptoms. Make a list of your symptoms and bring it with you to your medical visit. 2. Bring your medical history. Bring your medical history, including your medications and medical conditions. 3. Ask questions. Ask questions during your medical visit to ensure that you understand your diagnosis and treatment plan. 4. Follow up. Follow up with your doctor after your medical visit to ensure that you are receiving the care you need. Conclusion. Seeking medical attention is an important part of maintaining good health and preventing illnesses from becoming more serious. By understanding when to seek medical attention and what to expect during a medical visit, you can take an active role in your healthcare and improve your overall health. Recommendations. If you're unsure about when to seek medical attention or what to expect during a medical visit, here are some recommendations. 1. Consult with your doctor. Consult with your doctor if you have questions or concerns about your health. 2. Schedule regular checkups. Schedule regular checkups with your doctor to monitor your health and detect potential health problems early. 3. Seek medical attention immediately. Seek medical attention immediately if you are experiencing severe symptoms or if you have been injured. 4. Follow your treatment plan. Follow your treatment plan as directed by your doctor to ensure that you receive the care you need.